custom prostate cancer treatment with Dr. Lederman. 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman, Radiosurgery Hour. You're welcome to call us, 1-800-321-0710. We're on WOR. This is our last program of the week. Our next program is next Saturday morning at 5 to 6 a.m. on WABC, and we'll be on WOR 1:30 to 2:30 a.m., 3 to 4 a.m., 6 to 7 a.m., 9 to 10 p.m., 5 unique shows every weekend, and we have listeners who listen to all 5 shows. So congratulations to you. You're going to be a doctor soon. This is like medical school. We had a patient, and before I talk about this patient, I just want to tell you I took a call this morning from a man who said, why do you say someone's black or Hispanic, or why do you explain who they are? Why don't you just be generic about it? And I guess I could say this is a two-legged mammal, but that wouldn't be very descriptive for the person, the human being. And certain diseases are different in different people. For example, we know that the mortality rate, the death rate in black Americans is twice what it is in white Americans for prostate cancer and breast cancer. Certain groups have more propensity for different diseases like sickle cell cancer. So let's pretend we're in a medical rounds with medical doctors and that you're a medical person and you want to know as much as you can about this person. And that's why I try to describe each person in vivid detail so you can get an idea of who I'm talking about and why their case may relate to you, to them, and their family, and to other medical professionals. So, as I was saying, we have a 34-year-old black woman who came in, mother of 5. In 2008, she presented with loss of consciousness and terrible headaches. She was seen in another hospital. She was found to have a pituitary tumor. She was given medicines, but nothing more than medicines. She was never offered surgery, radiosurgery, radiation, or anything else. She came in to see me this week, and she's having still profound headaches. She was doubled over. I examined her, and most of her vision in the left side of the world and the upper part of the world was gone. So most probably she's got this pituitary tumor that's wrapped around the chiasm. The chiasm is the nerve that takes the vision from the eyes to the brain. All the vision in the body goes through the chiasm. If the chiasm gets cut off, the person goes blind. This woman is having progressive symptoms over 6 years, from 2008 until now. She's getting worse. She's had no visual field, no MRI, and no offer of treatment to try to reverse this tumor, to remove it or treat it so it stops pinching the chiasm. So it's a very serious condition. She's lost a significant amount of vision, probably half in both eyes. We arranged for her to get MRIs of her brain and pituitary, to get formal visual field testing. I've called to get all her documents from the other hospitals, put all together the data, and give her options to try to stop this tumor. It's a benign tumor that could cause her to be blind for the rest of her life. Imagine a 34-year-old woman, mother of 5, divorced, blind. Why? I don't know why. Can't understand why. But we're going to get to the bottom of it and make sure she has all the possibilities in the world. And on another topic, one we spoke about a bit earlier in the program, I've been seeing this man since about 2010. He's had a PSA that's ranged 3 to 4. He had several biopsies back then in 2010, 2011, which were negative. And now his PSA has jumped to 10.91. Well, what would you say if PSA jumped from 4 to 10.91? Either it's a lab error, and we're checking for that, or it's real, and he needs evaluation for prostate cancer. He's a 61-year-old man. He's fully functional, working, needs to know what's going on in the prostate. He's at high risk for prostate cancer. He is black. He has a rapidly rising PSA. There's something called the PSA velocity, which is how rapid the PSA climbs, and his has climbed very rapidly. So we've arranged for all this to be done. We'll report back to you about him. To all of you who are following your PSAs, you notice a bump in the PSAs. Well, yes, you can make sure it's not infection, it's not from sex, it's not from laboratory error. And if it's none of those things, you need to get evaluated. So don't put off. It won't help you. And I also saw this woman, 81-year-old woman from India with 8 children. She had weakness and a mass in the neck. It was originally thought to be a goiter. She had a big mass in the neck. She had a biopsy which showed not a goiter, but actually squamous cancer, a cancer of the head and neck area. She had standard radiation chemotherapy at a big cancer hospital nearby. Just last year, between September 2013 and March 2014, so she just finished treatment, got a PET scan there showing the cancer had progressed on standard chemoradiation. Cancer's in the oropharynx and neck. Surgery would be devastating for her. Her family brought her to us for consideration of radiosurgery. She has no cancer anywhere else in the body, one large mass in the neck and oropharynx. We are offering her radiosurgery amongst other treatments, and it's always up to the patient to decide. As I said earlier, the patient is the president of the United States of their body. She's lost weight. She's had a feeding tube in place and a trach for almost a year, even though she's had no aspiration. She's been unable to eat because of those tubes for a year. They were placed by the cancer hospital surgeons. So in summary, she has a head and neck cancer, squamous cell, given standard chemoradiation, large mass. She's chosen us to treat her, and we will treat her in 5 treatments with radiosurgery. Most probably we will be able to stop or shrink or reduce that mass significantly. Can't promise it, but highly likely that we can help her. And our last patient that I want to speak about tonight is a 72-year-old man who had rectal cancer 3 years ago. He had colonoscopy after a long hiatus. He had a 9-year gap and then had colonoscopy, which showed a low-lying rectal cancer. He had standard chemoradiation elsewhere, and then he had surgery because the cancer was so low, close to the anus. The doctors had to remove his anus, and so he's had a colostomy. This is all done elsewhere. He then had 3 of 9 post-operative chemotherapy treatments, which we actually know and reported on the show are unnecessary, don't improve the survival of patients with rectal cancer. His weight dropped from 150 to 129. He's now regained his weight, but an MRI of the abdomen looking at him showed lung metastases, which are new. So the chemotherapy did not stop the lung metastases. He came to us for evaluation, and we spoke to him about innovative treatment, including stereotactic radiosurgery. We spoke to him about biopsy-directed chemo, where we actually take some of the cancer cells, grow it in a laboratory, and find chemo that's custom-made for the patient. So rather than take chemo that's pushed by the drug company, try to find chemo that's custom-made for his cancer, and radiosurgery, which we know has about an 85 to 90% success rate in stopping rectal cancer in the lung, liver, or elsewhere. So our treatment is 15 minutes. Patients are placed in a stereotactic frame. It's non-invasive, non-claustrophobic, well-tolerated. People come in, get a treatment, 15 minutes later, go home, and generally tolerate the treatment very well. We then follow the patient with imaging, like PET scan or CAT scan or MRI, whatever is best for the patient and whatever the patient accepts. And the patient then has a independent record of what's happened, like a report card. It's a report card for us and a report card to the patient, what's happened to the cancer after our treatment. We had a call earlier today about how do we document our results. How do we get these data of 97% and 90% and 92% and 87%? Well, we get follow-up scans after a baseline scan. When a patient comes to us, we get a scan to know the size and shape and location of the cancer. The patient gets treated, and then we get follow-up scans done by independent radiologists to tell us the results. So we are out of the picture. Radiologists independently tell us, is it better, worse, or the same? You have that copy. You know what's going on with you, and then you can make decisions on further treatment or not. Again, thank you for listening. This is Dr. Lederman, Radiosurgery New York. We're at 38th and Broadway. Give us a call at 212-CHOICES, 212-CHOICES for that free booklet DVD to ask questions, or better yet, come in for a consultation. Thank you, good night, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.